We good, Walter? Okay. So I know this topic is sensitive, but it's important. How do HIV rates among men who have sex with men impact women?
It's tremendous. One of the reasons why is that um, the areas for the interaction with men is extremely vascular, but it does not have a natural lubricant in place.
And when
So
we say
the
vascular,
friction,
can we break down vascular?
in the rectal cavity itself, it does not have its natural lubricant. There's no natural lubricant
Gotcha.
that comes into play. So when you bring artificial lubricants in place, the amount of friction that's created can cause micro tears,
Gotcha.
and it
Okay.
commonly does.
Okay.
It also can give the recipient hemorrhoids. So the risk is much greater for the man who's the recipient than it is the person who's actually the top per se.
Gotcha.
That's why the 1 in 900 piece comes into play. But the issue is for women is that in many cases this is not disclosed to them because men like to maintain some sense of privacy, but that's the reason why questioning and having communications is so important with women and men is that, hey, I want to know what behaviors you participate in so that I can keep myself safe or make the choice or the option to participate or not.
Yeah. And that's a perfect
Yeah.
way to put it.
Yeah.
And choose whether to participate or not. Because at the end of the day, it's your body.
Yeah.
It's your choice. And why is HIV risk more about networks than individual behavior?
Because you have to remember, unprotected sex for women, or even for men, but more so for women, because you're the receptacle, you're sleeping with everybody he slept with.
Oy, 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 what?
And everybody that he slept with.
Charles, make it stop. Oh, God. Okay.
That's the reality.
That's the reality. That's the reality.
Yeah, so if they live a free lifestyle,
Yeah.
yeah, you're sleeping with a lot of different people
Yeah. And
in one encounter, and that's what you're not getting. You don't see, the
Exactly.
little box. That's the gift. It keeps on giving.
yeah. And this is not to shame or
No.
anyone's choices. It's just making sure that whatever choice you make, you have full clarity behind it and that you're going into any situation with clarity behind
Yeah.
it. Because at the end of the day, again, it's your health.
Yeah.
And so what should women know about routine HIV testing?
Once again, you probably want to at least go annually if you're having unprotected sex, at minimum.
Yeah.
If you start to see any symptoms of just not being yourself, not during cold and flu season,
Yeah.
but general fatigue and things of that nature, or you're being sick all the time with infections or upper respiratory infections and stuff like that. Those are the things you take to your PCP and just say, hey, maybe I want to just check my status to make sure that I'm good.
Yeah.
But that communication with your partner to make sure they're
That's so
yeah.
important.
Because even if your partner, because the stigma of HIV is very negative, but if their viral load is at a certain level, they cannot pass it on to you.
That's what I've seen
So I
from all
want
the
to be very,
commercials.
very clear.
Yeah.
They cannot pass it on to
Yeah.
you. But the issue is, do they know what their status is?
Right. And because if they don't know and they
Yeah.
are HIV positive, they're definitely that load that you're referencing,
Yeah.
like they don't know.
Yeah.
And so, question for you, what conversations should women feel empowered to have with their partners?
Everything.
Everything.
Because at the end of the day, the encounter has a more profound effect on you as a receptacle
Yeah.
than it does on him.
Yeah.
Those are the facts.
I mean,
So-
just hearing this gives a whole new perspective because you don't realize, I mean, it's just like what you said with, that stress lying in our bodies from 14 generations. I
Yeah.
mean, this is like,
That's
when
the
you
reality.
think about the web out, this is the web out sexually, basically.
Yeah.
And to understand where it stands. Thank you for that.
Yeah.
And
It's-
go get tested.
Please get tested.
Yeah, get tested. Know your status. That was segment 5. This was reproductive.